It is my pleasure to invite Dr. Ofen Korenfeld, and you will be telling us about integrating macroeconomic and public health impacts and social planning policies for pandemic response. I will switch to here.
So I caught a virus and under the weather, so let's see what happens. I will present an analysis of policy response to future pandemics. This is work done with a group in Maryland University led by Joshua White. He's working in viral dynamics, quantitative dynamics, a group from Georgia Tech, which is led by Professor Vardi. He's dealing with control and optimal, and a group from Tel Aviv University led by Eran Yashiv. So we're focusing on trying to do public health economic trade-offs. We look to a method to manage a suitable balance of mortality rates versus economic cost related to lockdowns. No? So policymakers, when are encountered with a pandemic, need to take decisions on both ends. One, they want to reduce mortality, and the second end, they want to reduce the economic cost. Even though it's a recognized problem, there's still a lack of good decision tools for integrating epidemics and microeconomic dynamics in a realistic way. So we're trying to figure out a way, quite simple. I hope I will be able to explain it in order to how to balance these two contradicting goals. I'm going the wrong way. So the model is coupled with both epidemic dynamics, a behavioral response of people, economic activity, and policy plans which are feasible or plausible to do. So the first understanding is people are careful. They're not vegetables, they're human, they react to the situations. So when you study disease, you need to take that into considerations. The second thing is that laissez-faire, doing no action, is not an option because people will react to a disease. So when there is a disease and there is mortality, people are careful, they would not work. They would avoid being in interactions with other people. There would be less economic activity. So if you do nothing, then you will have both a disease and mortality and a drop in economic activity. So and one other thing which is important is when the disease starts, there is a big uncertainty, both on disease parameters like infectiousness period or latency period. You don't know what's the mortality rate, how many people are going to die. You don't know how careful people would be. You don't know the infectiousness. You have estimate about things. Quite rapidly we'd have estimates, but you are facing a lot of uncertainty. So in order to tackle that, you need to do things. So we study both fixed response. This is just for explanations. Nobody really doing a fixed response to a disease. Also dynamic and feedback control. And we are trying to balance these two using a framework of thinking which is based on welfare loss, what is welfare loss, and the value of reduced mortality. So this is an economic concept, value of reduced mortality, trying to estimate value of life. It's things that economics people are doing, but basically there's a lot of words which are said that we're not putting value dollars on lives, but we are putting value dollars on life. It's the explanation is long. It's based on the willingness of people to pay for reducing the chances of being dead by paying small amounts of money, and from that you can calculate what's the value of life. But basically that's what we're doing. Anyway, in order to balance mortality with economic cost, you need to do something like that. What I would say that we've done a lot of studies on these parameters. It doesn't really matter much, the value of life. And many parameters do not matter much on what is the optimal or best way to respond to a disease. If a disease is twice as deadly, it doesn't matter much for what's the correct behavior. I did again to the other way around. So let's see. Can I point with this? Yes. This is hard. So this is, where am I? This is the model. So here we have, when a disease started, we have some estimate on the disease parameters. And these, I gave examples, but there are many in our models. Just to name a few, people have fatigue, so they are careful. There's some carefulness in which they have to begin with, but after a while, they would be less careful. Right? So the estimation of how infectious a disease are, what's the reproduction rate, how people will react to education, etc. So many unknowns. From this, the policymaker need to create a policy. There are many policy tools, but at least in the COVID case, the main policy tool that was used was lockdowns or restrictions on work. So we simplify that, and we just assume that the main tool that is the policy tool, the main policy tool is the reduction of employment. So from the policy, there is a reduction of employment. This in turn, so people work less, they meet less, there are less interactions. So this in turn affects the disease dynamics. So I would soon will explain that, but basically we have an SEIRD model for the disease dynamics, and the employment dictates how infectious the disease is. Also from the disease dynamics, there is an impact back to employment, because people who are infectious work less. They are either locked down or they are quarantined, so they work less. When there is a disease dynamics, there are results, so some people are dead. Now, when people witness other people dying, they are afraid. They are more careful. So this triggers endogenous response. So people are careful, they avoid from meeting other people, and in this in turn, reduce the employment dynamics. So from all this, we have the economic, the employment reduction, which is directly have an economic impact. And for the mortality side, we have the public health impact. So we balance it. We allocate weights to these two, and we have something we call a welfare. Welfare is the subjective way people perceive their wellness. So we have this welfare. We want to optimize it, and this gives us the policy. So all this may provide us with a good policy tool. That may give us an optimal solution. What is the best policy we can make? The problem is that reality is more complex than that, and then optimal solutions are very fragile. So small change in parameters, especially in dynamic environments, may lead to very different consequences. So apart from that, we devised a tool that will enable us to measure the reality and have a feedback back to the policy. So I will present, so this is the model. Parameters, policy making, the lockdown tool, impacting the disease dynamics, that cause mortality, which goes back to employment and comes back to the weighting process, the balancing process, and create the optimal policy, and a feedback that might change our way of thinking what is optimal. I'm going backwards again. So the epidemiological block, the disease dynamic is SAIRD model, standard SAIRD model. And I will just point the time varying incidence beta T SI, which S is the susceptible portion of fraction in the population, and I is in the infectious part of the population. And this incidence is governing the disease progress. And it is modulated by beta T. Beta T is the infectiousness parameter, which is composed of few parameters. So this is the baseline interaction, which is not impacted by the economic activity, which is how infectious the virus is. And this parameter is depending on how much of the population is working, and it is if the population is fully working, then this parameter is not active. And the last part is a part which is a rapid change in behavior, in the infectiousness, which is governed by people learning. So we have a baseline interaction of the economy when it is open is beta W plus beta lambda here. And there is the rapid behavioral adaptation of the population over a short time. When the disease starts, people are guided, they learn hygiene, masking, etc. So they change rapidly their behavior. In a short time, they are more careful. And there's the endogenous behavior, which is explained earlier, which is modeled as in here. When people are working less, the disease is less infectious. And the employment level is how many people are working is related to the economic activity. This is governed by both the policy, which disallow people from working, and from their own endogenous behavior. And what we get here is the reproduction number is basically this beta number governing the progress of the disease divided by gamma, which is the removal rate, or the inverse of the infectiousness period. The macroeconomic model is quite simple. It's there is a GDP, the gross domestic part, which is linearly related to the amount of work which is done, and we assume that wages are constant and the output is fully consumed. This is a very, very basic economy, and as I said, employment is influenced by both individual response and the social planner, which may impose lockdowns on people. And we assume that what happened? And we assume that the amount that people are working is the maximum of both. So if the endogenous response is high, it may exceed the lockdown imposed by the government, and the other way around. Okay, so this is the welfare loss. I will explain it shortly. So the welfare loss is what the social planner is trying to minimize. It's basically, in here is the welfare of the population. It is defined by people who are either sick or dead. They are not working, so there is a complete loss for their welfare. There is part of which is partly working. They are not happy because there's lockdown. People are not happy when there is lockdown, and there is an amount of welfare loss due to mortality. So the aim of the planner is to minimize all this. So we also assume that the time we are trying to minimize is the time until vaccination are available, and this is the reason for this first part of the integral, which is trying to, what's the word? Trying to balance the welfare loss according to the probability of getting the disease, the vaccination in place in the right amount of time. So we assume some probability of getting a vaccination. So we are studying fixed, we're trying to figure out what's the best fixed policy. So the fixed policy, assuming that a long time of the disease, there is one policy, not like we've seen in reality. There are changes, but a simple saying like 20% of the population will not be able to work. So we start, if there's no intervention at all, there is a big endogenous response. This scenario leads to both higher mortality rate and high economic loss. And if there is a range of we're studying a range of fixed policies, ranging between doing nothing and maximum of available lockdown. Maximum available lockdown from economic studies is around 30%. You can't really lock down more people because there are essential part of the economy you can't lock down, like health institutions, government institutions, public transportation, the army, the police, etc. So this is the first set of results. You can see here. You can see here. This is the death, and this axis is ranging from doing nothing, which is no employment reduction, to maximum employment reduction, and we see it under three scenarios. When there is a medium-based disease transmission, and when it is higher and when it is lower, and you can see that when there's no intervention, there is a big death present, and as you install lockdowns, it's a quick reduction. And you can see that if the disease is less infectious, obviously it has less impact. And you can see here that the impact on employment is whenever you reach the point that the disease is fully controlled, it's linear, obviously, that the cost is linear with the amount of lockdown. But when you start, if you do nothing, there is a cost associated with the endogenous response. And you can see here that this is the welfare, the combined result of these two. And you can see that it has some minimum around here. And if the disease is less infectious, then the optimal lockdown is around here. You need to lock down only 5% of the population. In here, you need like 15%, and etc. So this is like a fixed optimal. So it's very easy to find what is the optimal fixed solution. Each time. And this is a different parameter. So the first parameter I've shown was the parameter of infectiousness. This is the variation in the efficacy of employment reduction on transmission. So this is a parameter that says if people are in less interaction, how it would affect the infectiousness. And that depends on many things. So we don't know that ahead of time. We have some estimation of that, and we can see similar behavior of the model of the result. If there's no efficacy, then obviously the results are bad, and if the efficacy is higher, the results are better. So we are not trying to find a fixed reduction policy. We're trying to find the optimal policy response. So I will show here. What's going on? I'm lost in the, where am I? So, yeah. Okay. So we try to find time-dependent policies. So we find out there is time-dependent policy. We solve the problem with using optimal control algorithms, and we can change the policy according to time. We start with some lockdown, and then we can change it, etc. You can find a policy that can change every day. This is obviously not practical, so we've done an optimal policy and a second optimal policy with only few switches, in which there are only 3 periods, which is called a stepwise policy. And you can see the results here. So so this one is when the disease the infectiousness is high. This is when it's medium, and this is when it's low. You can see that in all occasions, the optimal policy looks similar. It begins by, at the beginning, it starts a bit low, then it increases, and then it goes down near the end of the time where you can expect the vaccines are soon. And you can see that the stepwise policy, which is like having 3 periods, is similar in structure in what is optimal. And right. So you can see here that comparing the results on the welfare level, and on both ends of the in here you can see on the left-hand side, you can see the no intervention policy, and on the right-hand side a full lockdown policy. In the middle you can see the optimal policy. So the left one is the fixed policy, the second one is the piecewise policy, and the third is the optimal policy. And you can see you can achieve a significant improvement, but you can see also that it's not a big improvement being optimal in several manners. The problem is the problem is that you need to have full knowledge of the disease parameter in order to find what is optimal, and this is not known. So we have a problem that the optimal control problems are very sensitive to misspecifications. So how do we assess that? We take the problem with one set of parameter, we change the parameter, and we simulate it with the 4 minutes, yeah, I will finish. We simulate the optimal policy with the different set of parameters, and you can see here the result. The purple curve here shows what happens. What is the difference in the death toll, in the economic policy, and the welfare between if you assume one set of parameter, and in fact we have a different set of parameters. So the axis here, the x-axis, is the infectiousness of the disease. So here is what we assumed. So it coincides here and here and here is what we assumed. And you can see that when the pathogen is less transmissible, then there's less death, but when the pathogen is more transmissible, then you would see the high increase in death. And this is the economic activity, and in here is the welfare. So in here it coincides, but you can see that the welfare loss is quite big. If you are mistaken on both sides, if you have a pathogen which is less transmissible, you would have more death, and if you have a pathogen which is less transmissible, you would have a less economic activity. But if you look at the, just a second, if you look at the green line is when we take the measurement from reality. So in reality, we measure the reproduction rate, which is quite available, and we compare it with what we think is optimal. And we are doing what is called tracking. So we have a tracking algorithm in which what we try to do is we try to keep the reproduction level in reality similar to what we think it is in reality. And you can see that the result of the simulation, the green lines are similar to the optimal results. Yeah, okay. Comparison. בדיוק. Okay, so if you know a disease parameter, you can have an optimal policy. Stepwise policy are closely approximated with the fully continuous optimal policy. The optimal policies throughout keep policies near 1, and if you misestimate transmission, this is a large welfare loss. But if you have feedback control and you look at reality and change the policy according to what is reality, you get optimal policy even without knowing the parameters. And looking forward, what we're trying to do is to expand our policy toolkit in 2 manners. One of them is expanding it when parameters are really far from what we estimated. And the second one, we're trying to to simulate the model using different definitions of uncertainty and ambiguity. And this is it.